Hey YouTube, welcome back to my channel. So this topic is going to be, or today's video is going to be about the spectrum of akathisia. So I had a conversation with someone the other day about how akathisia seems to be on a spectrum, and for some people it's somewhat mild, and for other people it's completely severe and completely debilitating. And again, there is some debate in this community of whether or not you truly have akathisia if you're not pacing all the time. And so everybody seems to describe it differently, and a lot of people have difficulty describing exactly what they feel is going on in their body. All they know is that they're intensely uncomfortable and they feel they can't relax and they feel like they have to move. And so I'm going to give my opinion on this, but first of all I want to read straight from the Barnes Akathisia scale. So not everybody's familiar with this. I realize I've had conversations with some people lately and they're like, what are you talking about? So the Barnes Akathisia rating scale is what clinicians use or are supposed to use as diagnostic criteria for diagnosing akathisia. And in the akathisia rating scale itself, it divides it into objective and subjective. So I'm going to first start out this conversation by reading from this directly from this scale. So this is what was used on me to diagnose myself by, I believe it was a psychiatrist at first. I've been diagnosed by a few different people. So on my actual forms, it's my GP, but then I had a neurologist involved and a psychiatrist involved. Well, several psychiatrists, but only one that seemed to really understand what was happening to me. So first, it says patients should be observed while they are seated and then standing while engaged in neutral conversation for a minimum of 2 minutes in each position. Symptoms observed in other situations, for example, while engaged in activity on the ward, may also be rated. Subsequently, the subjective phenomena should be elicited by direct questioning. So the first part is the objective. So a 0 rating is normal occasional fidgety movements of the limbs. 1 is presence of characteristic restless movements, shuffling or tramping movements of the legs/feet, or swinging of one leg while sitting and or rocking from foot to foot or walking on the spot when standing, but movements present for less than half the time observed. A 2 is observed phenomena as described in 1 above, which are present for at least half the observation period. And then a 3 is patient is constantly engaged in characteristic restless movements and or has the inability to remain seated or standing without walking or pacing during the time observed. And then the subjective is it's divided into 2 parts. So the first part is awareness of restlessness. So a 0 is absence of inner restlessness. A 1 is non-specific sense of inner restlessness. 2 is the patient is aware of an inability to keep the legs still or a desire to move the legs and or complains of inner restlessness aggravated specifically by being required to stand still. And then 3 is awareness of intense compulsion to move most of the time and or reports strong desire to walk or pace most of the time. And then the second part of the subjective is distress related to restlessness. So a 0 is no distress, 1 mild, 2 moderate, and 3 severe. And then it says underneath, so this is the rating of the akathisia. So the global clinical assessment of akathisia. So a 0 is absent, no evidence of awareness of restlessness, observation of characteristic movements of akathisia in the absence of a subjective report of inner restlessness or compulsive desire to move the legs should be classified as pseudo akathisia. 1 is questionable, non-specific inner tension and fidgety movements. 2 is mild akathisia, so awareness of restlessness in the legs and or inner restlessness worse when required to stand still. Fidgety movements present but characteristic restless movements of akathisia not necessarily observed. Condition causes little or no distress. And then 3, moderate akathisia, awareness of restlessness as described for mild akathisia above, combined with characteristic restless movements such as rocking from foot to foot when standing. Patient finds the condition distressing. 4 is marked akathisia, so subjective experience of restlessness includes a compulsive desire to walk or pace. However, the patient is able to remain seated for at least 5 minutes. The condition is obviously distressing. And then 5 is severe akathisia, so the patient reports a strong compulsion to pace up and down most of the time, unable to sit or lie down for more than a few minutes, constant restlessness, which is associated with intense distress and insomnia. So that's the Barnes Akathisia rating scale. So again, there's subjective and objective parts to it. But I've then seen in other places like Inner Compass, and the way that they describe akathisia is different from this. So I mean, the problem with psychiatric diagnoses and then the injury from the meds is that really all of it is subjective to a degree, because there's no blood test, there's no actual, brain scan, there's no measuring of chemicals that can really classify any of this in a truly objective way. So that's the problem in the first place. That's the problem with psychiatry, and then that's the problem with the med injuries from psychiatric drugs. So, I mean, I've heard people describe what they call akathisia, and I'll tell you that the only time that I truly paced was when I took Seroquel. So I was taking Seroquel at the same time that I had TMS, which is transcranial magnetic stimulation. And I remember just like kind of dancing around on the spot. And I remember like pacing around in the clinic. And then also, but I was only able to take Seroquel for a short time because I literally pooped blood for a month while I was taking that medication. It was really horrible for me. And then later on, when I was cold turkeyed off benzos because my involuntary movements were so severe, I do remember pacing around the psych ward. And so those were really the only 2 times that I paced, but I had and have had a ton of the inner restlessness. So I've heard people describe this in different ways, and I'll kind of combine what people have described it, how people have described it to me, and also how I have described it. So I've heard it described as thrashing, nerve shocking, pulsating electrocution, grinding, explosions or exploding, or intense like churning. I've heard it described in all those different ways. And I mean, see, that's another problem. So psychiatry loves to put things into nice little boxes. Like if you have these symptoms for this amount of time, then we call it bipolar disorder. If you have these symptoms for this length of time, we call it schizophrenia or mania or anxiety or depression or OCD or whatever. And it's all like not based on anything measurable. And like I said, it's the same thing with this. So there's kind of like dystonia, and then there's tardive dyskinesia, there's akathisia, there's all of these things involuntary movements, and they all tend to kind of overlap. And there's these criteria like the Barnes Akathisia rating scale, and there's criteria for all these, but again, they're all just subjective. They're not based on anything measurable. I mean, they can't measure your brain chemicals. They don't diagnose things based on brain scans or blood tests, or they can't even, like, you can have like your urine tested for your levels of neurotransmitters and all that. Like you can have the OAT test. I had that done, but it still doesn't tell you what's going on at any given time in the brain. And so all of these things, they tend to overlap. And so like, unless you're looking for a specific diagnosis of akathisia or TD for disability purposes, I mean, I don't know if it's super important to have the labels, or if it's even that. I sometimes just wonder, is it all just the same injury, but it's just people are experiencing it differently, and then depending on which doctor they're going to, they're going to call it different things. So one's going to call this certain description of a symptom from a patient as akathisia, and someone else is going to call it tardive dyskinesia. And yeah, there are some objective, like the shuffling and the rocking and the pacing and the walking, and then like with the dystonia, like there's certain movements with the mouth, and TD, and like with there are obviously some objective criteria, but at the same time, like, what is the basis of it? Like, is the basis of it still the same brain injury? Is it still the same area of the brain that's affected? Is it the same area of the nervous system, the spine, whatever? Nobody really knows for sure. So I don't know if it's super important to, But anyway, I just wonder, because there's so many people with this subjective inner restlessness, like I said, that describes it so differently. And I kind of use those terms like shocking and electrocution and pulsating and churning and grinding and chopping. And it'll be, people will say, well, my nerves feel like glass. Like, what is that? What are those feelings like that? For me, like I said, I only paced when I took Seroquel, and then when I was in the ward and I was first pulled off benzos cold turkey. But I have had so much of that inner restlessness feelings. And then I have had the involuntary full body jerking, full body movements. And again, they just called it an involuntary musculoskeletal movement disorder, which yes, it is. But then I've had people give me opinions. Well, you must have TD, or this is dystonic movements, or this is part of akathisia. Is it like, can you categorize it when you can't do anything like measurable? And I mean, you can observe it, but it's not actually physically measurable where you can, it's not like a diabetic when you poke their finger and you're like, oh, their blood sugar is this. So you know for sure that they need this much insulin and this many units. Whereas this is just, everybody's getting different diagnosis, if any at all, depending on the doctor that they see. And the doctor's just observing them or asking them questions about how they feel on the inside. So again, that subjective part of akathisia. So yeah, I don't know. It's something that's debatable. And I mean, a lot of people aren't even getting the akathisia diagnosis who clearly have it. I mean, how many times do people go to the ER or go to try to get help, and then they're just told, oh, well, you have a psychiatric problem, or you have mental illness, or you have severe anxiety. I mean, yeah, I mean, it's all just, it's such a nightmare. And that's something else that adds so much stress to people's experience here is, the gaslighting and the inability to get a diagnosis. Because again, if you're going to be put on disability, you're going to need some type of diagnosis. And then it's like, okay, yeah, there are these treatments out there, but are they actually treatments, or are they just suppressing the symptoms? And the whole thing is just, it's so stressful. And I feel so much for the people in this community, because I've been through all of those scenarios. I did all of the doctor hopping. I went through every psychiatrist in the area. I was gaslit so many times. I took 8 medications, but I was probably prescribed 15 to 20. My mom has somewhere 2 boxes full of all of the things I was prescribed because of all of my individual symptoms. Again, that were all from the same neurological injury, but I was getting tons of different diagnoses depending on who I was seeing. So that's the problem with this. It is all, at the end of the day, subjective, except you can see, yeah, some people have the outer movements, but a lot of people are experiencing that inner distress, but you can't see it. And so, but it's still indicative of those conditions and these conditions. And then some people will say in the community, well, I have severe mental akathisia. Well, what does that mean? For me, it wasn't until I started getting those extreme cortisol rushes, bomb going off in my head feeling like my nervous system had exploded. That was when the mental got extreme. And I've heard that from so many different people, where it's like, once I got those akathisic symptoms, that was when my mind was just gone. Like, I have no control over my mind. I started hallucinating. The subconscious became conscious. Just this nightmare, these nightmare mental symptoms. I mean, I had them extremely severely. And it wasn't until I started getting all of those intense neurological symptoms on the inside, specifically in my torso, that I started getting the mental so bad. Some people will describe it as a burning or grinding or sloshing brain feeling. And I have definitely had a lot of the burning brain, burning face. I mean, what is that? Is that just like inflammation? Is it excessive neurotransmitter activity? Is it lack of neurotransmitters? I mean, that's the problem with this. Like, there's nothing measurable about it. I mean, I could go on all day about this, but I think, again, I don't know if it's necessary to have a diagnosis unless you're looking for disability, or I shouldn't say it's not necessary, because if you are needing to get some of the treatments for akathisia, or are trying, or you want to try some of the treatments, you obviously need a diagnosis there. And if you're trying to get disability, but also, like, I wonder if this is all just an underlying, the same brain injury from these meds that's happening in every single person. It's just the manifestation of it is different, and there is so much overlap in how people describe it. Well, this person describes it exactly the same as this person, but they both have a different diagnosis. So that's a problem. But let me know, like, have you been diagnosed with akathisia? Are you self-diagnosed? And what are your symptoms? Do you have the objective and the subjective based on what I read from the Barnes scale? Is yours something completely different? Do you only describe yours as inner? Do you have the mental stuff as well? Because some people don't, and some people really have the mental severely and not as much the physical. So I'm curious how your own has manifested, and whether you've had that diagnosis, and what your opinions are on this. So yeah, my throat's getting dry. I gotta go, but I hope you're doing well, and I'll see you in the next one. Bye.